Subscribe to the channel and press the bell icon to watch latest healthcare videos.
Hi, I'm Dr. Anup Katyal. I'm going to discuss today about COVID-19, the variants of COVID-19, and briefly talk about the management. We have all been aware of the second wave that hit India with very devastating consequences. Mainly, we realized that during the second wave, there was the Delta variant that was highly transmissible. This is something that WHO has classified as Alpha, Beta, Gamma, and Delta. Alpha variant is the one that originated in United Kingdom and was highly transmissible than the original wild type virus. Beta variant is the one that originated in South Africa. Gamma variant is the one that originated in Brazil, and Delta variant is the one that originated in India. It is also B16172. What ends up happening is that there are about 12 mutations that occur in the spike protein. It is very well known that viruses mutate all the time, and the Delta variant is about 60 times more transmissible than the wild type virus. And this leads to twice as many hospitalizations. This was the predominant variant in India, and this has spread now to more than 70 countries. This has also become the predominant variant in United Kingdom and is likely to become the predominant variant even in United States. There is also recent reports of a new variant called Delta Plus. This is a variant where there is another mutation to the receptor binding domain of the spike protein, and the initial thought is that this will render certain treatments ineffective, including monoclonal antibodies. The only way one can avoid these variants is by getting vaccinated. So I would urge everyone to get vaccinated. We do have some data arising from studies with AstraZeneca vaccine, which is the Covishield in India, and the Pfizer vaccine. 2 doses of Covishield and the Pfizer mRNA vaccine provide 60 to 90% protection against the Delta variant respectively. So it is very, very important that everyone get themselves vaccinated as soon as they can. If you are not vaccinated, the only way of preventing the spread is by following physical distance as well as wearing masks and avoiding crowded places. Good thing about the variant is that we can prevent it by vaccination. And if this spreads, and if the Delta Plus variant becomes the dominant variant, it would make things very difficult with regards to the third wave that is being predicted in India. Luckily, as of now, we have only had about 42 cases in India, and hopefully we can prevent the spread of this Delta Plus variant by creating more awareness about how transmissible this virus is. There is an old saying that prevention is better than cure, and this is very applicable to COVID-19. I will briefly discuss the treatment options for COVID-19. Luckily, 85% of the people who develop COVID-19 have mild to moderate COVID, which does not require hospitalization. But there's a small subset that needs hospitalization. Once you get into the hospital, these are the treatment options we have. I would also like to mention that one has to understand the pathophysiology of COVID-19 infection. It can affect any organ system of your body. We are currently focused on the lungs, but it can involve the brain, the heart, the kidneys, and the GI tract. Initially, in the first 7 days, it's the viral replication that causes the symptoms like fever, cough and shortness of breath, and after 7 days it's the immune response which leads to effects on the lungs and other systems. So once that occurs, one has to be very careful as to how one manages COVID-19. The first 7 days, the treatment is mainly symptomatic, treat the fever, and once your oxygen levels start to drop, that usually happens between 7 to 14 days from onset of symptoms, then one may need to go to the hospital if your oxygen levels drop below 94% on room air. Once you enter the hospital, if your onset of symptoms is less than 10 days, there might be a role of a drug called remdesivir, which is an antiviral drug. If patients' oxygen levels are low, we start with nasal cannula, which gives you 1 to 6 liters of oxygen. Then, if need be, we can go to 7 to 15 liters. This is called high flow nasal cannula. And if we need more, we can do something called high humidity, high flow cannula, which gives you 100% oxygen and the flow is 60 liters. In some instances, we use a mask which provides positive pressure, either CPAP or BiPAP. The most tricky question is timing of intubation, and it is generally felt that if you can avoid intubation as long as you can, the better off you are. Sometimes we also tell patients to flip on their stomach to improve the oxygenation. In addition to remdesivir, other treatment options that we have are medications called immunomodulators, and some of them that have been studied include steroids called dexamethasone. We also use sometimes other immunomodulators like IL-6 inhibitors, like tocilizumab or Janus canis inhibitors. Nothing else works. In select situations, we may offer VV ECMO. One other thing that has been studied more recently is use of monoclonal antibodies, and there is some data to suggest that monoclonal antibodies may also be effective in reducing mortality in patients admitted with COVID. So in general, remdesivir decreases time to recovery from 15 to 10 days. Steroids, IL-6 inhibitors, Janus kinase inhibitors, and monoclonal antibodies in certain select cases can decrease mortality. One question that is frequently asked is CRP levels and D-dimer. So CRP is a marker for inflammation that can go up in relationship to COVID-19 or any other infection or inflammation, and that is something that we follow in patients who are admitted to the hospital. One other question is about D-dimer levels. D-dimer is associated with thrombosis, but is also associated with bleeding and is also a marker for severity of COVID-19 infection. So in general, the current consensus is that if you are sick enough to be in the ICU, you should be on prophylactic doses of anticoagulation to prevent blood clots. At the same time, you should be on the lookout for blood clots, whether one does ultrasound of the legs called venous Dopplers or CT angiogram of the chest to document pulmonary embolism. If you have a blood clot in the legs or a clot in the lungs, then you need to be on full dose anticoagulation. As far as discharge from the hospital is concerned, the decision on continuing anticoagulation after discharge is guided on a case-by-case basis, evaluating the risks and benefits of continuing anticoagulation after discharge. Thank you for your time and thanks for listening.